Well, you've made quite an impression on several people in the Middle Georgia area. Almost to the point when I was reading the information on you, I almost got teary-eyed. But some of your tennis players, and I want to just mention this, Allison Walthall, a member of Stratford's girls tennis team, said, and I quote, "If anyone is going to beat this, it's her. She's got the biggest heart and most positive attitude of anybody. She's so encouraging to us," end quote. Grady Smith, Stratford's athletic director, said, quote, "If anyone is going to beat leukemia, it's her," end quote. And I'm almost getting a little teary-eyed now as I'm talking about it. How does that make you feel that people in the Macon community express those type of deep feelings and deep compassion for you as a person?
Well, it's a feeling that I can't even express. It really means a lot to me, and it means a lot that I can inspire people, because that's what makes me tick. Right. Is to help people, to inspire people, and so to hear things like that, it really means a lot to me.
And something else that really touched my heart was the team was playing in a championship, and you felt that the team was going to be more concerned about winning because they wanted to do it for you, because you'd just been diagnosed with leukemia. But your mantra was, you are responsible for your effort, not the outcome of the game. I thought that was so amazing for you to express that to them in what you were going through. Expound on that a little bit. What were you thinking during that time?
The irony of that is I had seen that quote back during the summer, and I sent a note to everybody on the teams from the year before, because we had won state. And so I sent a note to everybody on the team, and I gave them that quote, and I asked everybody what it meant to them, that I wanted them to send me an email and tell me what that quote meant to them. And then at the end of the season, when this happened, and it was just the irony of it to me that I could bring that back up. And we talked about that, the team meeting before the state championship. And I said to them, I said, please don't win this for me.
Right.
I said, you've all already made me so proud to get to this point. Don't put that pressure on yourself to win this for me. Just go out and you're responsible for the effort.
Right.
If you put it, 100% effort into it and give it your all, if you lose, then, you can hold your head up high and say, I tried my hardest.
Right.
So that's what I meant by you're responsible for the effort, not the outcome. And that I've kind of used that with this. I'm responsible for my effort and how I am going through this whole treatment, and listening to the doctors, and exercising, and having that positive mental attitude. But I certainly am not responsible for the outcome.
I think that's something that can cross over into all of our lives.
It sure is.
Worry about the effort and not worry about the end result. We just need to do it. We were talking about before we started airing, just do it.
Right. That's right.
Follow the Nike slogan, just do it.
Right.
I also read that there is the Jamie Kaplan Tennis Center at Stratford.
That's right.
Now, you had no idea that this was happening. So tell us about that day that they unveiled the Jamie Kaplan Tennis Center.
Well, the center was ready last spring. We got to play the weather before that was just, we had so much rain when they were building those courts. I think that they did, in 6 weeks, they did the equivalent of 7 days work, they told me. It was crazy because it would rain and they couldn't get out there because it was just mud. So we were delayed a little bit getting the courts ready. We actually played on the last week of the season, and then I got the diagnosis soon after that, and they wanted to dedicate the courts, and I had no idea that they just said they wanted me there because I helped raise the money, and yeah, they did, and they had set October 1st. They were going to do it because that was, I think, alumni weekend, and they were having all kinds of things there, and it was actually my birthday, which would have been a nice birthday present, but that we weren't sure. They had to plan it in advance, and we weren't sure that I would be able to come home, and as it was, I was able to, but it was too late to plan it because we didn't know until the day before. But so they set it for another date, and somebody said something about I think my brother couldn't be there or something, and so they changed it again. I'm like, well, what does he have to do with this? Why does he need to be there? And my family kept putting it to me, we want to be there to support you because you were so instrumental in raising the money for the facility. So I was told that I was giving a speech that day because I was supposed to talk about, the courts and what it means to the tennis program. And so I was on the agenda to give a speech, and then I did my thing and I sat down, and then I was called back up there by Ashley Copeland, who was, she's president of the Booster Club this year, and then I was called up by her, and she and her family were very instrumental in the facility being built, and one of the donors for the facility, and they had the naming rights, and so she called me back up there and started talking about me, and I'm sitting there going, why is she talking about me so much? And then they had this sign up above that was covered up, and then they said, well, turn around and look at the sign, and they pulled the tarp off of it and had my name on it. And so it just, again, a feeling I can't even, yeah. And
you're still coaching to this day, am I correct?
Well, I'm not back coaching yet. I haven't been released to work yet, so I go out there and spy on them a little bit. And
that's okay.
Yeah.
That's okay.
And so I miss being out there with the kids. We have 63 on our varsity team, and we have 56 on the JV team, which I'm just thrilled about. We were talking yesterday that from 6th to 12th grade, that's about 20% of the students are on the tennis teams, which is wonderful. And I just can't wait to get back out there with them. Dr. Jones's daughter's on my tennis team. And
I heard.
Yeah.
I heard.
So I think she's told on me a couple of times. Yeah.
You know what? When we talk to Dr. Jones, we're going to ask her
That's right.
questions.
That's extra wind sprints for her daughter.
Exactly. Today. Well, Jamie, listen, it's been great having you on the show.
Thank you so much for having me.
Appreciate you. Thank you very much. Hey, we'll be right back. There are 259,889 people living with or in remission from leukemia in the United States. Approximately 30% more males are living with leukemia than females. More males than females are diagnosed with leukemia and die. Leukemia causes about 1/3 of all cancer death in children younger than 15 years. Welcome back to Perspectives. We're talking with Dr. Cheryl Jones, who's an oncologist at Georgia Cancer Specialists, who's board certified in oncology and internal medicine. Dr. Jones, thank you for joining us on today.
Thank you.
Let's talk about leukemia a little bit more. We just talked with Jamie Kaplan, and we hear that you are her oncologist.
That's correct.
So you had a hand in her treatment. So what are some of the more common signs and symptoms that we see in patients with leukemia? I know Jamie said she started having sciatic nerve pain, and initially it was a little rocky as to what was really going on. Have you seen that before? Is that common?
No, that's not common. Jamie has a very unusual type of acute leukemia with the extramedullary, or not starting in the bone marrow cells, because that's really what leukemia is most commonly thought of. It's a disease of the bone marrow and the blood-forming cells. Now, there are many types of leukemia. There's both the acute and very aggressive leukemias, like what Jamie has, and there are also chronic leukemias, which are more slow-growing and very different in their treatment. So the symptoms most often may be very nonspecific. It may be something as simple as tiredness, easy bruising, bleeding, such as when you brush your teeth, or nosebleeds that are unexpected, or even recurrent infections that just don't seem to clear up. So the symptoms can be very different for different individuals.
So it kind of presents itself as just run-of-the-mill, normal-day illnesses, pretty much.
Right. Or if someone begins to notice bruising or bleeding that they hadn't had, they barely bumped themselves and they have a new bruise, that may be a reason to check with their medical doctor to get their blood counts checked to see what's causing that.
Is leukemia mostly hereditary, or what are some of the causes? Is it triggered by exogenous factors, or what are some of the causes of it?
There are some very, very rare and unusual forms of leukemia that are inherited, but that's not typical for most patients. There are some risk factors, some exposure to radiation, some chemotherapy drugs that can cause, but most often we don't know what the exact cause is.
So how was it diagnosed, actually? I know, Jamie had an x-ray that said she had a fracture, and then from there, was there a biopsy, or what are some of the diagnostic
Right. It's typically not diagnosed by an X-ray. Again, Jamie's case was very unusual. The most common first symptom is that in the blood test, called a CBC, where we check somebody's hemoglobin, or red blood cells, their white blood cells, which are abnormal in leukemia, and their platelets, the part of the blood that help patients stop bleeding. So it's typically a blood count that is abnormal, and that begins to trigger the diagnosis. And then the next step is often a bone marrow aspiration and biopsy.
Okay. So once the diagnosis is made and it's confirmatory that it's leukemia, what would be the next step as far as treatment?
Right. The next step, of course, determines which type of leukemia is. If it is an acute leukemia, like Jamie's was an acute myelogenous leukemia or acute lymphoblastic leukemia, those are very aggressive chemotherapy regimens that are often used with consolidation of bone marrow transplantations, experiences that Jamie had.
Right.
If it's a chronic leukemia, such as chronic myelogenous leukemia, that's actually treated with some of the new medications called tyrosine kinase inhibitors that are actually oral tablets that have been shown to put some patients into remission with a tablet.
Okay.
Those patients, curative therapy for those patients can be transplantation. However, because of the side effects of transplantation and our new medical advances, that's not often recommended up front anymore. And then chronic lymphocytic leukemia is a disease that can sometimes be so slow growing for individuals that sometimes we don't even begin treatment but follow the patients until treatment is needed. So it really depends on what type of treatment an individual has.
Now that kind of leads into my next question. As far as treatment is concerned, what I've heard for cancer in general, there are several side effects that the patients can experience as a result of the treatment in addition to the actual leukemia or the actual cancer diagnosis. So highlight some of those things that can happen as a result of treatment.
Right. So I think when everybody thinks about chemotherapy, the things that they think of very first are the very strong medications that we give to kill the cancer cells, so in this case the leukemia cells, the abnormal cells, which also affects some of the body's normal cells. So you think of the side effects of nausea and vomiting, which affects the nutrition of the patient. We think of the visible side effects, such as the hair loss. And piggybacking on that, Jamie and I candidly spoke before the show, and she said she and I really could be twins because her hair was just like mine at one point. Exactly. Not too long ago, as a matter of fact, yes. And that's a side effect from the chemotherapy. But as you could tell, in speaking with Jamie, when the chemotherapy is through the body, the hair comes back beautifully. So the article that I read, that they've written several wonderful, eloquent articles on Jamie. There was a quote that you gave that spoke of Jamie and how her athletic ability was a benefit to her improving. What would you recommend patients do while they're going through treatment as far as diet and nutrition, exercise, what have you? Well, of course, Jamie made that sort of ideal patient because when she started and when she was diagnosed, she was fit, and she had good, healthy lifestyle habits already. She's still fit. I think she made me look bad, actually. Yes. She probably walked more than you and I did this morning. Yeah, exactly. So that's an important factor in anybody's health for any type of treatment, whether it's chemotherapy or surgery. If you have a fit patient who already has those lifestyles, they're going to heal better, they're going to get into any treatment better and be determined to continue those habits. However, it doesn't always happen that way. Right. Sometimes things we've gotten a little lapse on, what we should do, we know what we should do. Those are always things that patients can improve on their own. But staying active, moving, is so important with any type of cancer treatment. It's been shown to improve tolerance to treatment, improve all the side effects, and the energy that patients have if they remain active. And that can be as simple as just walking, a few minutes a day or doing some minor exercise. Wow. Some really good information. Dr. Jones, we thank you for being on the show today. Listen, you're a friend of the show now. Okay. So we would like to have you back on the show at some point in time. We'll be right back with Perspectives. To learn more about leukemia, visit www.leukemia.org or visit perspectivestv.com.